Electronic Visit Verification, EVV, Guidance and Training, WNYIL Taking Control Training for Personal Assistants, PAs, July 2024. What is Electronic Visit Verification, or EVV? It is a data collection system requiring the use of compliant technologies in order to record services provided to our consumers of the CD PAS program. For WNYIL, the data collection system that is compliant would be the use of the consumer's telephone for you to clock in and clock out, utilizing a unique identifying PIN number. The data collected from this transaction is recorded by care time. What does this all mean? This means that when you clock in and clock out using the consumer's phone, the data collected from that transaction is stored in care time. Care time tracks this information and then creates data reports to send to Medicaid so that New York State can ensure that services that are billed to and paid by Medicaid have actually been provided by a PA to the consumer based on the consumer's authorization and care plans. Additionally, the use of EVV enables WNYIL to ensure timely service delivery for consumers, include real-time service reporting and monitoring of all PAs, clock-ins, and clock-outs, safeguard the consumers who are authorized to receive services are getting the expected care per their authorizations and care plans. Why do we have to implement an electronic visit verification system? The 21st Century Cures Act. The 21st Century Cures Act is a federal law passed by Congress December 13, 2016, mandating that states receiving federal Medicaid dollars must implement electronic visit verification, or EVV, for all Medicaid-funded personal care services, PCS, and home health care services, HHCS, that require an in-home visit by a provider or staff. The mandated New York State implementation date for EVV use for our CD PAS program was January 1st, 2021. New York State selected the choice model, which allows individual providers to select the EVV system that will best work for them. The CARES Act requires that the EVV system capture the following 6 data points: service type, individual receiving the service, date of service, location of service delivery, individual providing the services, and the begin and end times of the service. WNYIL has chosen to continue using care time as our EVV service provider of choice for the agency in order to ensure continued compliance with the requirements set forth by the 21st Century Cures Act. System Overview, Workflow, Data Collection. WNYIL has chosen to utilize the electronic visit verification data system, care time. All PAs recording time spent working for consumers enrolled in the Taking Control program are required to use care time for all clock-ins and clock-outs. PAs will do so by using the consumer's telephone to dial the 1-800 number for care time, to clock in at the start of their shift, and then again to clock out at the end of their shift, using their personal PIN number assigned by our Taking Control department. This PIN number will only be assigned to the PA after the PA has been successfully onboarded by our Taking Control staff and the consumer has received all authorizations into the program for the provision of services. Manual documentation of EVV data. Occasionally, there may be a situation where the PA is not able to use the consumer's phone to clock in or clock out, or the care time system is temporarily unavailable. In that type of situation, the consumer must contact the Taking Control customer service team with details of the PA's shift, including the date and times of the shift, so it can be manually entered into care time by our taking control staff. The taking control staff will document in the electronic consumer record, WELligent, the information provided by the consumer, and then they will manually enter the shift into care time. How to electronically collect EVV data when there are multiple caregivers. Each PA will be required to clock in to the EVV system using the consumer's telephone, and upon dialing in, will enter their PIN number. This combination of the consumer's telephone number and the PA PIN number will record the date and times of the shift for that particular PA to be recorded in the EVV system as providing services for that particular consumer. Should another PA be working at the same time for another consumer within the same household, that PA would follow the same practice of clocking in and clocking out for their consumer, so they are properly identified for the date and time of their shift as well. How to electronically collect EVV data when there are multiple consumers. When there are multiple consumers in the home assigned to one PA, the PA will follow the automated prompts to choose their assigned consumer and will clock in and clock out as standard practice for each consumer on the correct dates and times of the shifts. How the EVV collects the data. Data collected from PAs clocking in and clocking out from the consumer's telephone will be automatically stored in care time. Data collected by care time will be sent monthly to eMedNY that allows New York State Medicaid providers to submit claims and receive payments for Medicaid-covered services provided to eligible members. Monthly data will be submitted by the WNYIL Accounting Department to the eMedNY EVV portal. What information must be shared with the consumers and their families about EVV? PAs should discuss the New York State Department of Health electronic visit verification fact sheet that the consumer would have received from their taking control administrator at their point of intake. Should the consumers and/or their families have any questions, they can call our taking control customer service phone number at 1-800-348-8399 and speak to one of our WNYIL taking control staff for assistance. Consumers and their families will be able to access the resources on the internet that are provided in this PowerPoint. Consumers and their families will also have access to the fact sheets, PowerPoints, and other guidance materials on WNYIL's Taking Control Agency website at www.takingcontrolnewyork.org, www.takingcontrolny.org. What information must be shared? For further information or questions, they can also contact our Taking Control customer service line at 1-800-348-8399. They can check the required resources listed within this PowerPoint, as well as the New York State Department of Health fact sheets. The required resources New York State has are maintained for individuals and entities to find or receive information on the state EVV program. The following resources were either used or quoted in the creation of this training and, as required by New York State Department of Health, are being credited for their content used, copied, or referred to within the training. They are also required references for users of the EVV system per the New York State Department of Health requirements. As you see here before you, there is a list of individual websites that were used to create this PowerPoint that can be used for reference by the PAs, by the consumers, or the consumers' families or support systems.